Hi, Dr. John here with NBC News, Dr. John Torres, going over this Facebook Live where I give you some headlines that happened over the last few days, get behind those headlines, give you some in-depth knowledge to what that actually means. So you're not just getting that one-liner, but you're getting an understanding of what that one-liner actually means and how it can impact your life or might going forward, and hopefully get some information that we can all use to get this pandemic over with sooner rather than later, because that's the main goal here, that we all stay safe and healthy through the pandemic as best we can, but that overall we end this pandemic, because right now globally it's taking its toll. And talking about that, that's one of the headlines I want to talk about, are what's happening around the world, and particularly what's happening here in the U.S. with cases. In the U.S., you might be hearing that there's a third wave of coronavirus or a second wave or a second surge. Those are a bit semantics, and what they're talking about essentially is that we're seeing a swing in COVID cases on the rise. In other words, these cases are starting to build up in certain areas, some states worse than others, but vastly across the country here in the U.S., most states are seeing an upswing in cases. The biggest one is probably Wisconsin, where they're seeing a higher number of cases there than anywhere else than they've seen in the past. Hospitals are having some issues. And as a matter of fact, some hospitals have actually started to put up surge tents, which are tents they put outside when patients don't need the ICU, but they still need to keep an eye on them. They've been putting some of them in the surge tents to make room in the ICU. Overall capacity is still pretty good across the country. We're not running into the ventilator issues or the ICU issues, or for the most part, the PPE issues we've had in the past, although it's possible we could start getting shortages on those if these systems start getting overrun. Now, according to some sources, PPE for the big hospitals, that's personal protective equipment, goggles, masks, gowns, gloves, those things that we use to keep safe when we're taking care of patients. For big hospital systems, not an issue right now. The supplies seem to be holding out fairly well. But for non-hospital facilities, a lot of them are complaining that they're not getting the PPE they need to take care of patients, because they're the ones that are taking care of patients who aren't in the hospital yet, trying to keep everybody else healthy. Same time, they need to make sure they keep that PPE on to protect the hospital workers as well and to protect the patients. But again, whether you talk about the second surge, the third surge, a new wave of coronavirus, regardless, we're heading into our winter months and we're heading into our huge holiday months as well. And that combination has a lot of experts concerned that we're going to start seeing even more cases. So let me give you a little description of what's going on around the world. Right now here in the U.S., we have over 8 million cases of confirmed coronavirus here in the U.S. Unfortunately, over 220,000 deaths as well. Worldwide, over 40 million cases with over 1 million deaths. And so that number's building up. But more specifically, looking at countries, looking at different states, here in the U.S., looking at states. And what I did is I basically put these numbers per 100,000 people. So that way it evens out the board, because it's easy to say that here in the U.S. we have 220,000 cases. We have over 8 million cases. We had 70,000 cases the other day, but comparing that to a country that might only have 2,000 cases, it's not an equal comparison, because they might only have a population of 5 million or 330 million. So you can see where I'm going there. So mathematically, I'm trying to even the field here. So this is all per 100,000 people population. If you look at states here, Wisconsin right now, looking at over the last couple of days, 22 cases per 100,000 people per day. And so that's certainly on the rise. We do not like to see numbers that high. Colorado, where I'm at, 19 cases. Colorado's having an upswing, and they're starting to mandate certain things like masks, even if you're outside. They're looking at restaurants and bars, but haven't closed them yet. But these are things they're going to do to try and keep it under control. Florida, 15. Florida was having a good handle on things for a little bit. New York, who for a while had a great handle on things, they're even up to 8 right now, and those case numbers are rising. And so that's just here in the U.S. But if you start looking at the United States versus Europe in particular, again, here in the U.S., we're looking at around 17 cases overall per 100,000 people. Comparing that to some European countries, France is having a big issue. 38 cases per 100,000 people. Huge upswing in cases. Spain, similarly, 23 cases. Sweden, which got a lot of people looking at them because they weren't doing some of the things other countries were doing, they're up at 13 right now. So they're getting more cases, seem to be keeping a fairly good handle on it, but we'll see what happens as time goes on. Germany, who has done a great job, their cases are going up too. They're only at 7 right now, but it's higher than it's been in the past. Lithuania, small country, 6 per 100,000 people. But then expanding that view worldwide, again here in the U.S., we're talking 17 per 100,000 people population cases of coronavirus on a daily basis just over the last couple of days. Brazil, 11. So they're looking like they're having high numbers as well. Russia, 10. Those numbers are going up. And then if you look at a country like India, which we know is catching up to the U.S., right now they're looking at around 5 per day of coronavirus cases per 100,000 people. And so their numbers are high, but they also have a population that's much higher than ours as well. And so you have to keep that in mind. And so looking at overall what's going on, the U.S. unfortunately is still leading in that rate of coronavirus, even though they might not be leading. They are leading in overall numbers, but India is sure to catch up pretty quickly here. But the bottom line being that we still have a ways to go to get this under control. And some experts, there's a Dr. Michael Osterholm, he's an infectious disease expert. He was on MSNBC yesterday, and he said, which I think is appropriate, that right now we're going into the 6 weeks to 12 weeks of our darkest period of the pandemic. And the reason he said this is because we're coming into winter. This is the first true winter we're going to be in the pandemic, because last one started most of the way through our winter of 2019-20. This is 2021's winter, so we're getting the start of it. We'll start seeing more coronavirus cases. Plus, we're coinciding that with our holiday season, so people will be traveling, and hopefully not as much as in the past, because, again, we're in the midst of the pandemic. Plus, we'll be getting flu on top of that twin-demic of the coronavirus and flu at the same time. And so getting your flu shot can certainly go a long ways towards protecting you from one, and hopefully we can get this under control to a better extent as we wait for the vaccine, which will be something I'll be talking about in a little bit. But that's the overall numbers and what's happening around the world. Cases are starting to rise, and I think we're going to still see cases rise even higher and even more so. So we definitely need to buckle down. We definitely need to do those things we know we need to do to stay safe. And that leads me to my next story. You might have heard in different areas people talking about, well, 85% of people who wore masks still got coronavirus. And that's been quoted out by everybody from the president on down to some so-called experts saying, well, why are we wearing masks? 85% of people in this one study the CDC put out wore masks and they still got coronavirus. Well, the issue is that's not what the study said. That's not the way the study is interpreted. But these people are misinterpreting that study. So here's exactly what the study was looking at. It was a study looking to find out what kind of things put people at higher risk for coronavirus. So they took two groups. One group they called a control group. These are about 150, 170 people who did not get COVID-19. They compared that to the COVID group. These are the same number of people who got COVID-19. So again, two different sets of people here. One group did not get COVID-19. The other group got infected with COVID-19. They looked at both groups and said, okay, what are they doing similarly? Similarly, they found out through surveying them that 71 to 74% of them, depending on which group we're in, were saying, I wore masks most of the time. Remember, this is a survey, and so this is what people were telling them, not what was directly being observed. So people's memories sometimes aren't as strong as the researchers would like them to be. So 71 to 74% of them said, I wore masks most of the time. 85% said most or all of the time, so that's a bigger number, said I wore masks most or all of the time, 85% of them again. Differentiating factor here is then they looked at the two groups and said, okay, well, if everybody's wearing masks and they're doing all these things, they're social distancing, doing all these other things, why did this group get COVID-19 and this one not get COVID-19? It wasn't the masks. It wasn't the social distancing. What happened in there? And what they found out is the group that got COVID-19, they were twice as likely to have gone to a restaurant or 3 times as likely to have gone to a bar. And so what the researchers are saying is it has nothing to do with masks, has nothing to do with social distancing, comparing these two groups. But what they found is if you mask, you social distance, you do those things that you're supposed to do, but you still go to a bar or restaurant, that increases your chances of getting COVID-19, because guess what? You can't be at a bar or a restaurant drinking or eating with a mask on. So those people that said they wore their masks all the time or most of the time, when they were at the restaurant, they weren't wearing their masks. And so that's where that number comes in. And so for some reason, these folks ended up saying, well, let's lock on that number, 85%, when in fact the number they should be locking on are the chances of getting it going to a bar or a restaurant. The bottom line here doesn't mean don't go to a bar or restaurant. It means look at your area. If there's a hot spot, you want to think twice about going to a bar or restaurant. But you also want to make sure that if you are there and you have to take your mask off to eat or drink, that you're social distancing at the same time. You're doing it outside instead of inside. Those tricks we know that can help keep us protected from coronavirus. But again, the study did not at all say that 85% of people were wearing masks and they still got COVID. What the study said that even though all these people were wearing masks, what's the one thing that differentiated the ones that got COVID? They went to bars or restaurants. And so again, you have to look at the details of the study and understand how to interpret the study. So don't just look at that headline. And again, it's a fallacy, it's a myth. They did not say 85% of people who wore masks still got COVID. That is not at all what the study said. So hopefully that puts that to rest a little bit. But now on to the third headline, which is the vaccine. And we're getting closer to the race of the vaccine. As a matter of fact, there are one, maybe two vaccine manufacturers that said that they look like they're going to be seeking their emergency use authorization from the FDA by the end of November. We're in the middle of October right now, so we're talking 6 weeks from now. They're looking to try and get the emergency use authorization. That doesn't mean it's going to be authorized that day, but what it does mean is that they're going to look at it, the FDA will look at it, and then it'll probably take some time, maybe a month or so, to analyze the data and then come out with that emergency use authorization. Once that comes out, these manufacturers are already starting to manufacture the vaccine. So once it comes out, they'll start distributing it. And then we had talked in the past about how that distribution is going to work. One issue with that distribution, and if you saw in the headline today that they're hiring, I believe it's 15,000 people, might be more, for CVS, a pharmacy, to go ahead and help distribute the vaccine. One concern, and this was a concern with some experts I had talked about, especially last week on my Doc to Doc series, part of the issue is most of these vaccines need what's called ultra cold storage. Now, if you think about when you get your flu vaccine or you go to your doctor's office and they give your kids the regular vaccines they get, or you get a tetanus shot, those types of vaccines, those need basic refrigeration. And that's essentially the refrigeration that you can have in any clinic anywhere here in the United States. The problem with some of these vaccines is they need ultra cold storage. Ultra cold storage means that it has to be stored at minus 70 degrees centigrade. That's around minus 94 Fahrenheit. That's colder than the North Pole in the middle of winter. So it has to be cold, very cold. And the problem is these pharmacies won't have the equipment, or probably won't have the equipment, to store the vaccine. So they're not going to be able to give out some of the vaccines. So that's going to be a bit of a hurdle that the people looking at vaccine distribution are trying to figure that out, because that's going to be one of the big hurdles of getting the vaccine going forward. But they're looking at that right now. Hopefully when it comes to this distribution issue, they've got that sorted out. So talking to experts, they say what they think is going to happen, especially with these ultra cold storage vaccines, is they're probably going to have situations and sites set up in different regions, different cities, different neighborhoods, and saying, hey, if you get the vaccine, you come to this site to get the vaccine because we have it stored appropriately. Can't necessarily go to the pharmacist, but there are going to be a vaccine or two that are going to be at the pharmacist that could be stored at normal storage temperatures, and so that's certainly going to help as well. But just so we understand that there's no one key to getting all this vaccine distributed, the important part is make sure it's distributed so the vaccine stays safe, so we stay safe and we stay protected from coronavirus. But again, headlines, Europe, U.S., around the world, we're seeing increased cases of coronavirus. We need to double down on our efforts because it's just going to get worse. And as one doctor said, Dr. Osterholm, we have 6 to 12 months of probably the darkest period of coronavirus. And so that means that we really need to take care over the next couple of months, especially during the holidays, to protect ourselves and everybody else. Masks, again, that if you've heard the headline that 85% of people wearing masks still got coronavirus, that is not accurate. It had nothing to do with the study. That is not the information the study came out with. What the study came out with was that even though people said they were wearing masks, the ones that went to the bars and the restaurants were more likely to catch coronavirus because more than likely they took their masks off. Plus they weren't social distancing. And then the vaccine. There are going to be some hurdles when it comes to the vaccine, but getting through those hurdles is what they're working on right now. So keeping our fingers crossed that we get this vaccine hopefully here in the next couple of months and can start distributing it, especially to those in phase 1, which are the healthcare workers and those most vulnerable to coronavirus at this point. But now let me see if you have any questions.
Are we in the third wave of the coronavirus?
So are we in the third wave of the coronavirus? And again, it's semantics. It depends on where you are, what you're talking about, and if you're looking at your region, your city, your state, the nation, the world. It depends, but I think most experts will say we're at least surging up in cases. You might want to call it the second wave. Some places might call it the third wave. And what we know in some places is they've had a lot of cases. They were kept under control. Opened up, had a lot more cases, kept it under control, opened up a lot more cases. They have that third surge or third wave. Other places have basically gotten under control, seems to be keeping it under control, and some other places got it under control, and then it's back up again, a second type of wave. So it's a bit of semantics, but essentially the bottom line is, especially here in the U.S., we are seeing an upswing in cases, so we all need to do those things we need to do in order to keep it under control to protect ourselves, our family, and our community.
Is the U.S. reaching herd immunity? Please explain.
So is the U.S. reaching herd immunity? The answer is no. We are not reaching herd immunity. Right now, by some estimates, if you look at the testing and the way it's worked out, is around 2% of people have tested positive for coronavirus here in the U.S. Herd immunity has to be somewhere between, and depending on the experts you talk to, right around 60%. Some experts say 40 to 80%. So 60% is kind of right in the middle, and that's more than likely 60 plus higher percent is what we need for herd immunity. Experts using what they call serological examinations, and so they'll go through, if you donate blood for cholesterol, they went through and randomly tested some of this blood to see if you had any antibodies to coronavirus. If you had those antibodies, you're put in the category of exposed to coronavirus. And so what they're finding out is that people that had coronavirus, that were exposed to it, that's about 10% of the population. So keeping optimistic numbers here, 10% of the population possibly has immunity to coronavirus, at least short-term immunity. We need that 60%. So we're still lacking 50% of the population to get that immunity, not anywhere close to that. And if you remember last week on my Facebook Live, there was some conversation about should we do a natural herd immunity where we just let the disease run its course. We let people do what they want to do. If they get sick, then they'll get immune to it. And if enough people get immune to it, then we'll get herd immunity. That's not what we want to do at all. We want to make sure that we stay safe until we can get things like the vaccine, can get us that herd immunity through a vaccine, because the more people that get sick from coronavirus, the more people are going to die from coronavirus. The more they're going to spread it to more vulnerable people who are going to have complications from coronavirus. Not the way we want to go. And historically, we've looked at pandemics, and the ones before vaccines that basically relied on that natural herd immunity, death, devastations, changing of societies, changing of cultures. These were huge, epic events that took place in history. Don't want that to happen now. And that's why we're looking at the vaccine here to help supply us with herd immunity. But basically the premise is enough people get immune to the virus, hopefully through vaccines, to protect everybody else in the community who's maybe not immune from the virus.
If my family all had COVID-19, can we safely be together for the holidays?
So if your family all had COVID-19, can you safely be together for the holidays? No. You can safely be together from the holidays, but I think the premise behind the question is, can we do that without having to take precautions? No. You need to take the same precautions everybody else does for a variety of reasons. One, if you had COVID-19, didn't really have symptoms, but you tested positive, could it have been a false positive? It could have been. And so maybe you really didn't have COVID-19. But even if you really had COVID-19, if you had no symptoms, then more than likely you have a low number of antibodies. Those antibodies might have worn off by now, so you might not even be immune to COVID-19 at this point. There's a lot of scenarios here that were essentially, even though you had COVID-19, even though you possibly tested positive for antibodies, doesn't mean you're immune or you're not going to spread it to other people. So you have to be very careful. So regardless of whether you had COVID-19, whether you have antibodies or don't or didn't, you still need to take the same precautions. And the main warning for the holidays is essentially don't travel unless you have to. But we know families want to keep together for those holidays. They want to get together. They want to celebrate. But this is not going to be like past holidays. It's not going to be like future holidays. We're in the middle of a pandemic. And so what I'm telling people is, if you do want to get together with family, fine, pick one holiday and make that the holiday you get together with families. Minimize the number of people that are there. Look where people are coming from. If they're coming from a hotspot area, ask them not to come. If they're sick, ask them not to come. When you have your celebration, try and have it outside if you can. If it's too cold, try to open a window. Social distance, wear masks unless they're from your own household. Those things we know we need to do to stay safe, do this holiday season as well, because it's going to be important whether you tested positive, whether you have antibodies, or whether you in fact have never gotten sick from coronavirus. Everybody's on an equal plane this holiday season.
What about antibody tests? Where can we get them, and are they still available? Are they
negative?
Or?
Antibody tests are available. They're sort of ubiquitous. You can get them just about anywhere. Like most of the testing, it waxes and wanes whether there's difficulties getting them or not getting them. Your best bet is to simply Google my area and say, do a search, where can I get antibody testing, and you'll find out. Or talk to your doctor. They might have an idea, or the public health department where you live to get these antibody tests. The honesty of it, though, is the antibody test, other than supplying you with the information that, I had antibodies, I was exposed to coronavirus at some point, it really doesn't do much to change your life because, again, you're still going to need to wear a mask, social distance, wash your hands, ventilate your building as much as you can if other people are inside. So it doesn't stop you from doing that. For public health officials, it helps because it gives them an idea of the prevalence of coronavirus in their area. But beyond that, again, it doesn't really do much to help you other than knowing that, okay, at some point I had coronavirus. And so the important thing is just to keep protecting yourself. But there are ways you can get antibody tests. But again, the big caveat here, just because you test for antibodies, we have no idea what antibody level you need to get protection from coronavirus. We have no idea how long that protection lasts. And we do know in very rare circumstances, there's been a very, very limited number of people that have gotten a second case of coronavirus from a virus that's changed a little bit from the first one they had. So even though they had antibodies to it, they still got coronavirus on top of it. So it's theoretically possible that can happen as well. So you want to stay protected. So again, getting antibodies, other than giving you the information, kind of saying that, yes, I had coronavirus at some point, I have antibodies now, doesn't change anything in the way you handle the pandemic or the virus or your own safety or that of your family. But again, thank you for your questions. Wonderful. Going over the headlines we talked about. Around the world, there are upswings in cases. We all need to do those things. We know we need to do stay safe, and let me go over them. I call them the 4 W's. Wear a mask, watch your distance, wash your hands, and in windows, ventilate as much as you can, especially if you have people around who aren't in your household that you're concerned about possibly getting or giving coronavirus to. Masks do protect you from coronavirus. Cloth masks do protect you from coronavirus. Dr. Fauci even mentioned that yesterday on air. And so if you hear the headline, 85% of people wearing masks still got coronavirus, that is wrong. That is not what the study found out. The study found out that people, even if they said they wore masks, but if they had gone to a bar or restaurant, they were more likely to get coronavirus, more than likely because they had to take the mask off to eat or drink at that bar or restaurant. And then the third one is the vaccine. We're getting closer. Looks like within 6 weeks, a month and a half or so, the first group, 1 or 2 manufacturers are going to be looking for the emergency use authorization. And after that, it should start, once they get that authorization, which will probably be towards the end of the year, beginning of next year, they'll start getting the vaccine out and people can start getting it, at least in that first group of distribution. But distribution is going to be a bit of an issue because of that ultra cold storage that needs to be done. That's very specific and very expensive equipment that needs to be used to keep the vaccine safe. And that way we can get it to people. But the overall thing here, again, is to make sure that going on this week and going on for the next few weeks, because we're getting to that period of the pandemic where things are going to be a little rough, is that we all do the things we know we need to do to stay safe, keep us, our family, our community, our loved ones safe. And to quote Winston Churchill, I'm going to quote him a little bit, not exact wordage, but as far as I can remember, this is during World War II, 1942. His quote, which somebody else used and I thought was appropriate, is they asked him, are we at the beginning of the end? And what Winston Churchill said, which I think is appropriate for here, is we're not at the beginning of the end. We're not at the end of the end. We're not at the beginning of the end, but it's just quite possible we're at the end of the beginning, meaning that we're starting to get through that first part of the pandemic, working on that second part, but we learned a lot from the first part. So hopefully, again, we're at the end of the beginning of this whole pandemic, as Winston Churchill once said. Stay safe, my friends, and as always, I hope everybody stays as happy and as healthy as you can.